Hello, my name is Karen Sigala, and today we'll be discussing about euthanasia and physician-assisted suicide. The problem. Euthanasia and physician-assisted suicide is suicide done by the patient with a physician by their side. Um, Physician-assisted suicide, it is legal in a few countries like Belgium and the Netherlands, and in few states in America. The issue regarding with euthanasia, it goes many religious beliefs, and doctors can do no harm to the patients. Utilitarianism. Uh, the point of morality is to maximize the amount of happiness that we produce from every action, Macmillan. So, the overall happiness that a person comes from the action of the physician-assisted suicide. Ethical egoism, the theory that the right action is the one that advances one's own best interest. Wrong, 2019. This only produces one's own good, so they might go through the process but might be judged as a selfish person. The principle of autonomy implies that patients should be able to make important decisions for themselves and have confidential information protected. Macmillan. Uh, so the person can make the decision for themselves. This could be called euthanasia, which is done by one's consent. Theories against it. The principle of non-maleficent goes against the principle of autonomy, can do no harm based on the Hippocratic Oath. Kant ethics and natural law theory both focuses on the idea of life. Kant ethics, it would strips of one's own selfhood, and natural law theory is to preserve one's life. Arguments. Subjective relativism. The view that an action it is morally right if one approves of it. One action can be right for them, but wrong for another. Cultural relativism is the view that an action is morally right if one's culture approves of it. Wrong, 2019. Many countries have large numbers of religious individuals that would think that suicide is a sin, so it would be difficult for those who try to search for medical advice. And some logical fallacies, purification, bandwagon, appeal to tradition, and perfect solution. Before we go to the moral theory, we must know the regulations one has to go through so they can go through the euthanasia process. One has to have an illness and suffer from it. So, the moral theory. A person, most likely a terminally ill person, has the right to look for medical assisted euthanasia or suicide. Jerry Pratchett had a rare form of Alzheimer's disease. Jerry Pratchett knew that his disease would only get worse and make it difficult to do simple tasks. Therefore, Pratchett had the option to die with a physician by his side. The three criterion. Consistency with consider moral judgment. Does it go against our moral judgment? It does go against our moral judgment, but not to that one person. Number two, consistency of our moral experience. We do know that an ill person can go through the process, and it does allow for progression and growth in later on the years. Number three, usefulness in moral problem solving. It is useful and it is practical. And this is some data. 66.6% of people or patients would use drugs to end their lives, and 42% were female, 50 were male, 94 were white, 97 had college degrees. The majority were 69 to 85 years old, and 63 had cancer. And all of this was pre- prescription drugs. And these are my citations. Thank you very much.